This is Dr. Carolyn Harmon of Stridley Life Coaching. Welcome to my channel, and make sure that you click the like button to let Facebook know that you like my page. Click the subscribe so you can get all the new updates as they come. And of course, leave a comment to let me know how you really feel about my work. All right? In this clip, I interviewed Dr. Melissa Sinelli. She's going to tell us all about chiropractic care for chronic illnesses. So let's get to this interview. Here. All right. Hello, everybody. It's me, Carolyn, again from Stridley Coaching. And today we have a really special guest. She's going to tell us about functional medicine. And she's homegrown. She's right here in New Jersey, Red Bank, New Jersey, with Flourish Nutrition and Chiropractic Care. And this is chiropractor Melissa Sinelli. Hi, Melissa. How are you?
Oh, hi, Carolyn. I'm doing well. Thanks for having me here.
Thanks. I'm glad you could make it because we all, my group here is really interested in diabetic care, and they always are looking for alternatives to just the traditional ways of treating diabetes and testing for diabetes. And talking to you, I think, would be a great way for them to find things out. So I know you're a chiropractor and you're also a functional medicine practitioner. So how do those work for you in treating diabetics?
Okay. Well, for the chiropractic part, the diabetes is really more indirect, because when we're looking at the spine, we are looking at what's like the fuse box of the body. All the nerves come out of the spine from the spinal cord, which is an extension of the brain. And those nerves supply all the different organs in the body. And they keep our sympathetic, or our fight or flight, and our parasympathetic, which is more like the rest and digest part of our nervous system, in balance. So sometimes people with diabetes have neuropathy, meaning their nerves are not functioning great for their extremities. And with chiropractic, we're checking that right at the spinal level, where those nerves begin. Chiropractic is also great for reducing inflammation in a joint, and of course restoring alignment and mobility. And those things have been shown to help with the immune system, with the release of antibodies to fight infections, white blood cells, and with reducing blood pressure, reducing anxiety, sinus problems, all sorts of health problems, because of the correlation to the nervous system and the benefits to the nervous system. But from a functional medicine perspective, we help diabetes and people with pre-diabetes by looking at specific biomarkers, and more specifically using lifestyle modification factors, meaning diet and nutrition, and perhaps supplements and things like physical activity. Some people don't like the word exercise because they don't like to exercise, but we can be physically active without it being like such a boring type of mindset.
But they can work, they can walk, they can do yoga, they can hike. I mean, you can actually make it fun. You can play jump rope with your grandkids, just move, right? Or even dance. I like to dance in the kitchen.
Yeah, exactly.
I don't want to cook. I just want to dance.
I hear you. Put on the music. So you have to make it fun. It has to be somewhat enjoyable. Right. It has to work for you to be sustainable.
Right.
But there's this great study, this diabetes prevention program research group in the New England Journal of Medicine found that lifestyle intervention, meaning diet, exercise, and other modifiable things, reduced the incidence of diabetes by 58% compared to metformin, which reduced it by 31%. And these were compared to placebo. It was a double-blind, placebo-controlled study.
Okay.
So diet and exercise don't fail. But what I like to do with my clients is help them understand the biochemistry, like what's going on in the body, in an easy way, and
Right.
what happens, what are the benefits of certain foods, some functional foods,
Right.
and because food is medicine
Yeah,
or
yes.
poison, depending on which ones you're eating.
But it's one or the other. It's never in between. That's true,
Right.
Right.
Yeah.
Right.
And then once they understand, it's a lot easier to be compliant, to kind of adopt small changes over time.
Right.
Don't overwhelm people with like too much radical change.
Right.
It's just too overwhelming for them.
Now, a little earlier, you said something about you work with biomarkers. What kind of biomarkers are you talking about for diabetes in particular?
Okay. So obviously fasting blood glucose is going to
Okay.
be the major one. And when that goes over 99, people get alarmed, and we want to, of course, have that under 99. And then the hemoglobin A1C. So hemoglobin is something that circulates in the body for 4 months. And the amount of glucose in that cell gives us a longer term picture of how that person's blood sugar is. And so if I do that marker in the beginning, we'll do all these wonderful things together to get that number better. And then we'll recheck it in 4 months, because those cells live for 4 months. They turn over again in 120 days. Yeah. So we'll do that again. And people do great. I mean, they sometimes are so compliant that it goes the other way, where they're they're getting a little bit So if they're on medication, they'll often be a little bit too low. Their blood sugar will be too low, and then we know, we have to tweak that. So we're closely monitoring all the time to make sure nobody's going into an unhealthy zone. Right. But then I work with the endocrinologist to get their metformin reduced or whatever they're taking. Because now their body's doing it on its own. They're not as resistant to insulin. Right. And I explain what that means to patients, so they really get it. They understand what is insulin resistance. Right. How does my body weight have to do with that? Right. How much do I even need to lose? Do I even need to lose weight? Some people don't. Right. And they really grasp, how is diabetes or prediabetes related to cardiovascular disease? What's the connection? Blood sugar, heart disease? I don't even know. They can't even connect the dots. So I help them understand all those things. They really get it. And then they make a goal, a desire for what they want out of life. Right. What is their reason for, so for instance, my brother had diabetes, type 2. And it just dawned on him, you know what? I don't want to die. I mean, so his was like kind of a negative thing, where he was, there was something he didn't want. Right. And then he knew what he wanted. He wanted to kayak. He wanted to enjoy his children. He's like, he loves life.
He had a reason.
He had a reason. Right. And sometimes people, they know what they don't want, but they're really not as passionate about what they do want. So for them, I often suggest making a vision board, figuring out their why. Why do they want to be well? And what is their purpose? When my purpose is their well-being. And when they have a feeling like they can have well-being, and they have these desires and goals and dreams, they are now feeling, and they know that this is something they can
achieve. They can
achieve it.
They can achieve it.
It's very exciting. And it's
like a little light switch goes on in your brain, right? In their brains.
Yeah.
It's awesome. Yeah. It's awesome to see. Yeah.
Mm-hmm.
Yeah. I mean, it's kind of like giving them, putting the ball back in their court, giving them power over their being, because the way we've been structured in the society is like, well, go to the doctor and let him fix you. Like, your car is broke, you take it to the shop, it gets fixed. But your body, it's yours.
That's right.
and doctors know medicine, they know science, but you know your body, and you know when it's not feeling the way that it should, it's not operating the way it should. Because there's a lot of times we'll go to the doctor and we'll say, this is happening. They'll say, well, we don't see any reason why. It's okay, but it's not okay.
Yeah, Carolyn, you're so right. It happens, and very often, and I don't blame anybody in healthcare, because sometimes there's just not the time allotted in that type of practice that it is. But in functional medicine, we're looking at things called antecedents, which is basically the background, the history of the person, genetics, maybe events. For instance, it could be somebody was a teenager and they were taking a tremendous amount of antibiotics for acne. This used to happen where people would do that. Or now they're on birth control pills for acne and different things and they didn't realize it. But at the time that was affecting their microbiome, their intestinal health. Okay. And that set them up now for a problem down the road with inflammation, setting them up for leakiness in the permeability of the intestinal lining. So it set them up for food sensitivities. So for diabetes or pre-diabetes, an antecedent might be something like, hey, you know what? We always had soda in the house. We just, we drank it. And there's a study here that says drinking diet soda, so it's not just regular soda, daily increases your risk of metabolic syndrome by 36%. Wow. Metabolic syndrome is where you do have elevated blood sugar and you do have like an elevated waist circumference and blood pressure. So it's a syndrome of things. But so drinking diet soda increases your risk of type 2 diabetes by 67% compared to non-diet soda drinkers. And so they're not saying that, drinking sugar soda is better. It's just, that's not the solution either. It's just like, let's have a different drink.
Yeah. So, but what about people who won't drink the sugar? I mean, drink soda because of sugar, but they'll drink juice. Like they'll drink orange juice, they'll drink lemonade. I mean, is that better for you? Is that okay for you?
Well, obviously with the orange juice, you're getting vitamin C and you're getting potassium. However, you're way better eating the orange. The amount of oranges that goes into one glass of juice is so high that the amount of sugar is just too much all at once. So it causes our body to spike insulin. Insulin, remember, is, as you know, that hormone that's released that enables the sugar to get into our cells so we can make energy. But if too much sugar is released, and with juice, it's released so quickly because your body doesn't even have to digest it. So with an orange, you're chewing it, enzymes go off, you have to break it down. So the insulin doesn't spike, it's more slowly increasing. Right. So what happens when we have these insulin spikes too often is there's resistors on a cell. Your
receptors on the cell. Yeah.
Familiar with that? It's like a lock and key. Right. So when the insulin is released too often, it's like those receptors on the cell. Yeah. It's like they fold their arms and they're like, that's enough. You have just I'm worn out.
Receptors down, right?
Yeah, the receptors just aren't as responsive, and that's when we develop what's called insulin resistance. Right. So now the blood sugar, the sugar that's in the circulation in the blood is not getting into the cell. Right. Because we need that receptor to let it in. And so now the sugar is in the blood. Right.
And your muscles don't get the sugar, so you're tired, right? Your muscles don't want to move, right? That's how you feel, sluggish. Right. Mm-hmm.
And then remember, if you ever heated up sugar to make some kind of glaze or something, like in a frying pan, if you heat up sugar, what is it? It's sticky, right?
Yeah, very sticky, gooey. Yeah.
Yeah.
Caramelized.
Caramelized, right. So we don't want that in our blood because it makes sticky blood. Right. And that's where, atherosclerosis and cardiovascular disease come in.
So they're all in there related.